Next point, that is disorders of sex hormones. There are different disorders of sex hormones. In that, first PCOS, that is polycystic ovary syndrome. Then second hirsutism. Then next erectile dysfunction, and then gynecomastia. It means hypertrophy of male breast and hypogonadism. I am repeating, first that is hypogonadism. Then next gynecomastia, it means hypertrophy of male breast. Then erectile dysfunctions. Then it is hirsutism and PCOS, that is polycystic ovary syndrome. These are the disorders of sex hormones. In that disorders of, in that first female, it is PCOS, polycystic ovary syndrome. And hirsutism. And in case of male, erectile dysfunction, gynecomastia, that is hypertrophy of male breast, and hypogonadism. Yes, first that is PCOS. It is a disorder of sex hormone which is related to female. It is in that, what is this polycystic ovary syndrome, that is PCOS. It is a hormonal disorder common among a woman of reproductive age. It means the women with PCOS have infrequent or the prolonged menstrual periods or excess male hormone androgen level. Yes, in PCOS it means have infrequent or the prolonged menstrual periods or excess male hormone, that is androgen level. In that, the ovaries may develop a numerous small collection of fluid, that is follicles, and to fail to regularly release eggs. Then what are the different signs and symptoms? Yes, what is simply PCOS? It means what? Infrequent or prolonged menstrual periods. Yes, what are the signs and symptoms? First, that is irregular periods. Then second, excess androgen. Then polycystic ovaries. In that first, irregular periods, infrequent or the irregular or the prolonged menstrual cycle is the most common cause of PCOS. For example, the patient might have fewer than 9 periods in a year, or more than 35 days between the period, or the abnormally heavy periods. Then excess androgen, the elevated level of next cause, that is excess androgen. It means elevated level of male sex hormone may result in a physical signs such as excess facial and body hairs, that is hirsutism. It means excess of hair on face and body, it is hirsutism. And the next, polycystic ovaries. It means ovaries might be enlarged and contain follicles that surround the eggs, and as a result, the ovaries might fail functioning regularly. Due to this, the ovaries are not functioning properly. The next causes. The exact cause of PCOS is not known, but there are different factors might play an important role. It includes, first, that is excess insulin. Second, low grade inflammation. Then next, heredity. Then excess androgen. That first, excess insulin. If the cell become resistant to action of insulin, then the blood sugar level is increased and the body might produce a more insulin. I am repeating here, if cell become resistant to action of insulin, then what will happen? Then the blood sugar level is increased, and due to this the body produce more insulin, and this excess of insulin might increase the androgen production, and which causes the difficulty in ovulation. The next cause, low grade inflammation. Women with PCOS have a type of low grade inflammation that stimulate a polycystic ovaries to produce androgen, and which can lead to a blood vessel problem or the heart problem. Then heredity, then excess androgen. The ovaries produces the ovary produced abnormally high level of androgen, which causes a hirsutism and the acne. Then next, that is complication. In complication of PCOS, it includes infertility, then pregnancy induced high blood pressure, then miscarriage or premature birth, then non-alcoholic steatohepatitis, that is a severe liver inflammation which is caused by accumulation in the liver, then sleep apnea, then type 2 diabetes, then depression, anxiety, then eating disorders, then abnormal uterine bleeding, then obesity, then metabolic syndrome. It means a cluster of condition include high blood pressure, high blood sugar, and abnormal cholesterol or the triglyceride level that increase the risk of cardiovascular diseases. So this is all about PCOS. Next, that is hirsutism. It means the presence of excessive hair on body part of female. The next, erectile dysfunction, that is it is a type of sexual dysfunction which is characterized by inability to develop. It is a disorder of sex hormone which is related to male. Then next, gynecomastia, it means hypertrophy of male breast. And then last, that is hypogonadism. It means there is decreased production of testosterone. It means there is decreased production of testosterone.